Chapter 14, Urinary System. Venipuncture is for review only. There will not be any venipuncture questions on the exam next week, but please review it so that you have it for later on. You might need that. Slides 34 through 139 are review of what you just learned, as well as some positioning and some different exams mentioned, like your IVU, your enema, things like that. If you have any questions, you guys let me know. Benign prostatic hyperplasia, otherwise known as BPH. Enlargement of the prostate, benign, may cause urethral compression and obstruction. Males older than 50 years of age. You have an elevated or indented bladder floor. Radiographic exams include an IVU, erect post-void, and recumbent bladder, cystography. Bladder calculi, stones that form in the bladder, not as common as renal calculi. The radiographic appearance or calcifications within the bladder. You can view these via cystography, sonography, or CT. Bladder carcinoma, solid or papillary mass with mucosal involvement, more common in male after age 50. Hematuria, frequency in urination. Radiographic appearance is a mucosal change in the bladder. You're going to view these under cystography, CT, or an MRI. Congenital anomalies, structural or chemical imperfections, alterations present at birth. Duplication of the ureter and renal pelvis, two ureters and or renal pelvis from the same kidney. Ectopic kidney, normal kidney that fails to ascend to or into the abdomen, stays in the pelvis. Or horseshoe kidney, fusion of the kidneys during development, usually the lower pole. Malrotation is an abnormal rotation of the kidney that is evident when renal pelvis is turned from a medial to an anterior or posterior direction. The appearance depends on the nature of the anomaly. You're going to view this under an IVU, sonography, or CT. Cystitis, inflammation of the bladder caused by bacterial or fungal infection, confirmed by laboratory tests. The appearance is a mucosal changes within the bladder. You're going to see this under cystography. Glomerulonephritis, bright disease. Inflammation of the capillary loops of the glomeruli of the kidneys affects glomeruli and tubules. Acute would be in a large kidney. Chronic or small kidneys with blunt, rounded calyces. Radiographic appearance for the acute is normal or enlarged kidney with normal calyces. The chronic is bilateral small kidneys, blunted calyces. You're going to see this under an IVU, sonography, or nuclear med. Polycystic kidney disease. Cysts scattered throughout one or both kidneys. Genetic or congenital. Depending on the type, infantile, childhood, adult types. Symptoms include renal hypertension, proteinuria, and signs of chronic renal failure. Radiographic appearance includes an enlarged kidney, elongated renal pelvis, radiolucent areas that look like cysts throughout the cortex. IVU, CT, or MRI. Renal calculi. Calcifications occur in the luminal aspect of the urinary tract. Elevated levels of calcium in the urine. A staghorn calculus is a large stone that fills the renal pelvis completely. The radiographic appearance is signs of obstruction in the urinary system. You're going to do an IVU, CT, or nuke med to evaluate this. Renal cell carcinoma, hypernephroma, malignant tumor of the kidney. More common in males than females. You have flank pain and hematuria. Radiographic appearance is irregular appearance of parenchyma or collecting system. You're going to do an IVU, sonogram, or CT. Prostate carcinoma, slow-growing malignant tumor, commonly metastasized to bone. It looks like an elevated and distorted floor of contrast-filled bladder. You're going to do an IVU, erect position, ultrasound, or an MRI. Hydronephrosis, distension of the renal pelvis and calyces of the kidneys due to an obstruction of the ureters or renal pelvis. Radiographic appearance is an enlarged renal pelvis and calyces and ureteroproximal tube obstruction. Nephrogram becomes abnormally dense. The radiographic exams that you're going to perform would be an IVU or nephrography, sonography, and a retrograde urography. Pyelonephritis, inflammation of the kidney and renal pelvis caused by pyogenic pus-forming bacteria, affects interstitial tissue between the tubules. Radiographic appearance is a chronic patchy blunting of calyces with atrophy and thinning parenchyma. Do an IVU or sonogram. Renal hypertension, increased blood pressure to the kidney through the renal artery due to atherosclerosis. Severe hypertension can result in localized necrosis of the renal parenchyma. Radiographic appearance is small kidneys with delayed secretion and overconcentration of contrast media. You can do a hypertensive IVU series and a sonogram. Unfortunately, I found no images on this where hypertension is clearly visualized. Renal obstruction caused by necrotic debris, calculus, thrombus, or trauma, acute or chronic. Signs of obstruction in the urinary system. For the acute renal obstruction, it's reduced perfusion of contrast media through the kidney, delayed opacification of the collecting system. If it's chronic renal obstruction, calyces may show as enlarged hydronephrosis. You can see this under IVU, CT, will also reveal a tumor and a stone. Vesicorectal fistula. Vesicocolonic artificial opening forms between the urinary bladder and rectum as aspects of the colon due to trauma, tumor, or congenital defect. The appearance or signs of inflammation or fluid collections. Radiographic exams include a cystography, barium enema, or CT.